We're moving towards the next step of an integrated ambulance service that will serve the entire province.
The announcement today has two prongs. On the one hand, the province is swallowing up the private companies that provide road ambulance services now and integrating them with the publicly run service.
Currently, there are over 60 private operators. There are community services. There are public run through the Health Authority road ambulance services. Integrating them as one coordinated service, coordinated through a central dispatch, will provide efficiency.
NAPE, which represents many healthcare workers, believes making the road ambulance service public is a good idea, but it's opposed to the second part of this announcement that will see the public air service that we now have privatized. NAPE says this is a bad idea for the dozens of union members in the current air ambulance service.
These are Newfoundlanders and Labradorians that have provided emergency services for decades in many cases, and now they find out today, a few weeks before Christmas, that they are actually likely, because of privatization, could be out of work sometime within the next year or so. That's unacceptable.
And there's a further privatization. The province is contracting out the management of the integrated system to a private company instead of the Health Authority.
Having somebody manage and coordinate this, especially out of the gate, will ensure that we don't drop the ball.
Doesn't send a message, I guess, from my point of view, from the minister and this government, that they have a lot of confidence in the ability of the new health authority and their own public health managers and that to build this.
NAPE says it sees a trend towards privatization that it believes is worrisome.
And their premier made a statement publicly. We were assured workers. He assured our union, and he assured the people of Newfoundland and Labrador this was not a path he was on. Here we are again today, not once, this is several times now we've had this happen. It's unacceptable. It's a broken promise.
All parties agree the service needs to improve. The health minister says this sort of integration is the way to do that. He says the goal is to have the road ambulance system fully integrated within the next 12 months, and he says the air ambulance part might take longer. Mark Quinn, CBC News, St. John's.